and welcome to Senior Happenings. My name is Trisha Ayers and I'll be your host today. We're going to be talking a lot about Medicare in our segment because there's big changes coming up, and I know that you want to know some of the changes. But first, we're going to start off with a great program that is located in our area. It is the Community Paramedic Program, and we have Michael Pellegrino here, who is in charge.
Thank you.
I don't know whether I'm able to say that, but yes, Michael's in charge of this and has great information for us. So, Michael, thank you for being here this morning. Tell us about the paramedic program.
Well, we have a community paramedic program through the City of Bella Vista Fire Department that's 100% free to the citizens of Bella Vista. What we're offering is somebody like myself who's a licensed community paramedic. We do in-home visits. What we're looking to do is reduce falls and prevention as far as going to the hospital. We do in-home fall risk assessments, in-home general health assessments, just checking your meds, making sure we have your information updated, making sure you're taking your meds correctly. As far as the trip hazards, we're looking for cords, rugs, anything that's going to cause you to fall. We're not looking to take independence away. We're just looking to help increase your independence. While we're there, we'll also do a home safety inspection. We make sure your fire extinguishers are in order. You have smoke alarms, CO detectors if applicable. We work with your PCP if needed. If there's a concern for hospice or further care, we can contact Care Navigation and Hospice and work with them. We can also utilize many of our partners that we have out there. Our police department offers a Good Morning Bella Vista where they'll call every morning or send a text message, automated call every morning to make sure you're okay. Recommendations for life alert pendants.
People don't like to wear those.
They don't, but it's not a fallen that can't get up. It's a fallen, we need your help. People like to rely on their cell phones, but they don't always have their cell phones in hand. With that being said, if there is a fall and they can't get to their phone, that's the easiest way for us to come get them. And once we're there, we'd like to gain access to the house without breaking anything. So we have a residential lockbox program that we offer through the city. We also can use garage door codes or hidey keys. It just gives us easy access into the home without having to break anything. And then the PD has to come out and secure the home. So our goal is fall prevention, as well as this general health prevention. We don't mind coming seeing you and helping you. We don't mind taking you to the hospital, but at the same time, if we can prevent that, that's our goal right now.
I know I had a conversation with somebody once about, I think it was the ombudsman. One of the main reasons that our seniors go to nursing homes is because of medication and not taking the medication at the right time. So when you go in, what are some of the things that you...
Some of the things we do is we obtain their medical history as best we can. Hopefully they have a list, whether it's through Mercy or Northwest. We kind of go through the list, make sure that the meds are current. If they're not supposed to be taking those meds, we just double check with their primary care provider. We'll remove those meds from their cabinet or their tub or wherever they have it, and just kind of give them basic instructions that they may not receive from their physician or the pharmacist, or they may have forgotten. So we like to make sure their medications are in order. They're not double taking 2 different blood pressure medications for no reason from 2 different doctors.
Right.
So it's just re-education for most people, and some people it's new education.
Right.
And so we don't want them ended up in nursing homes or being transported for medication problems or falls, or for any reason, but especially falls.
Right.
So going back to the life alert, falling and sitting on the floor for 4 days, yes, you're injured, but the sitting for 4 days before somebody checks on you, that's going to cause more problems than most likely the fall itself.
So how do our seniors and other folks, not just seniors, I'm sure, can benefit from the paramedic program? Get involved. How do they know about it?
So we're trying to get out and speak to the communities, churches. Okay. I spoke to one church so far. I'm here today, which is another great start. What I've been doing is we have been going back to our call volume from the beginning of the year and calling everybody that has fallen that we have transported and calling them by phone and offering our services. And some people think it's not the fire department, so they call back and double check. But I've got really good responses. I've done over 50 visits in town in the last 3 months. A lot of just absolutely wonderful response from our citizens. But we do have a phone number to call our training center or main office at Station 1 at Town Center that they can call and request a visit.
Okay.
The visits take about 35 to 45 minutes. There's 6 of us that show up. We show up in a department vehicle in uniform, and we make suggestions. You can take one suggestion, you can take them all or ignore them all.
Okay.
Hopefully that they take some of the suggestions. And then we follow up too in a couple of weeks just to make sure everything's going good. So it's a great program. I know that I'd like to get into every house in the city, whether you think you need it or not. It's a great program, and our Chief Sims is 100% behind it, and we just want to keep growing it.
So if we have a senior who is coming home from the hospital and living by themselves, do you get notification from the hospital, or do you have to?
Unfortunately, we don't at this time.
Okay.
We don't get notifications from hospitals. We're working on getting notifications from hospice. One of our biggest concerns is a spouse, an elderly spouse, taking care of another elderly spouse. That is a big concern. So Mr. Johnson falls, Mrs. Johnson wants to help him up. That's not Mrs. Johnson's job. That's our job. Okay, so we come, we help Mr. Johnson up. There's no charge. We go back to our station. I like to come back, follow up, and try to make an appointment with Mrs. Johnson to see what we can do to prevent that fall. Additionally, in town we have children that are in their 50s and 60s taking care of their parents that are 80s and 90s.
Yes.
And it can become overwhelming for them. And so we can utilize a lot of resources to give them some help on how to take care of their parents, because there is no playbook for that.
Oh, no, absolutely. Do you work with in-home healthcare companies too?
We do. We work with Care Navigation is just one of them, but we work with several. Medicare does cover some portions of it. Some of it's out of pocket.
Yeah.
But if we identify a need of in-home health care is needed, in-home rehab services are needed, food deliveries, medication deliveries, social events, ride shares. There's a free van that comes in Bella Vista that takes people places.
A courtesy van.
Courtesy van. If we see trash, if there's not a straight road or driveway in Bella Vista. So if the person is having a hard time getting their trash up once a week, we can contact Allied Waste. As long as the trash can's available, the boy will come down, bring it up so they don't have to go to the street. This is little things to try to prevent these falls, especially with the winter months coming. Snow and ice. We don't need elderly people taking garbage cans 60 feet to the road. So.
And you're right, those small things make such a difference. And we want to keep our seniors mobile.
Mobile?
Yes.
Yep. And independent.
So full risks, that makes me giggle a little bit, because the person I work for is an elder law attorney, but he used to be a PT.
Right.
And his big thing when he did in-home PT was get the rug.
Get the rug.
Get the rug gone.
Yep. So
how do you finesse that?
So we don't want to rearrange your house. High traffic areas, we want to make sure that you have access to your high traffic areas without obstructions, whether it's a coffee table, end table, a cord, a rug. I don't want to take your rug away. But what I do want to do is maybe we'll get some Velcro or something to help keep the rug more secure. Rugs, cords, and pets. I can't control pets, but pets are like number 2 or 3 of getting between your legs and tripping.
Yes.
I haven't found an answer for the pets yet, but the rugs, cords, and it's recommendations. I'm not going to steal your rug and take it away from you, but we want to make sure that your pathways that you use to the kitchen and to the restroom are free and clear of any obstacles, so you don't fall.
Yeah, sure. So. Another thing that I was reading in this very handy-dandy pamphlet here was that you will go in and do flu shots if somebody has trouble getting out of their home.
So right now, if you go to our city website, which is bellavistaar.gov, on the front page there's a sign up for text messages. If you are homebound and you really can't get out very good, you have mobility issues, you can call that, you can follow that text message. They'll prompt you to go and sign up, and one of the community paramedics will go out. We offer flu shots and COVID boosters.
Oh, perfect.
In-home. It's 15, 20 minutes. We give you the booster or we give you the flu shot. We hang out for about 5 to 10 minutes. make sure you don't have any adverse reactions, ask you a few questions to make sure you qualify for it, and we're on our way.
If you're not tech savvy, you're welcome to call, right?
Yes,
Somebody will help you.
Yeah, if you're unable, like me, and you're not tech savvy, you can call the fire department, Station 1. They will schedule you an appointment to have that done.
Perfect.
Absolutely, yeah.
Perfect. Before we close out, is there anything else that you want us to know about the community program? You covered a lot of ground there.
Yeah, there was some resistance I've received from the citizens is I am 65, I move around, I go play golf, I hike, I kayak. It's not an age limit. If you live alone or you're elderly, it takes 35, 40 minutes for me to come in, just do a quick assessment. I'm, again, not trying to take independence away,
right.
Just trying to give you your independence and to stay healthy so we don't show up and see you on your worst day.
Absolutely. Great. An amazing program.
It is. It's great, and I hope that we grow it, and I hope to meet everybody in town.
So we're going to take a break right now, but I encourage you, if you are a church leader, have a social group, anything, reach out to Michael so he can come and speak to your group. It's very important that we continue on the education for this great program. We're going to take a short pause, and we will be back with our Medicare segment. Thank you so much.
Since 2008, Joel's Upholstery and Fabrics in Bentonville has been your go-to destination for top-notch upholstery and fabrics. With over 25,000 yards of in-stock upholstery and home decor fabrics, vinyls, leathers, and a vast design library, we make reupholstery easy and affordable. Our expert staff is available Monday through Friday from 8 a.m. to 4 p.m. to assist you. We cater to both commercial and household upholstery needs. Stay updated on our latest news, sales, and projects by following us on Facebook and Instagram.
Welcome back from the break. My name is Trisha Ayers, and I will be your host, and we are talking Medicare. It's the hot topic right now. If you are 65 and up, it's on your mind, and I know there's big changes coming up. So I asked 3 experts to come in this morning. So we have Paul Livingston from the agency NWA. That does sound like a secret agent. It does. Kimberly McPherson from MCP Insurance Solutions, and Jotham Cortez from Devoted Health. That was correct, yes? All right. Good introduction. We're off on right. So, Medicare. Paul, what are some of the changes coming up?
Well, I think what we're really seeing is one of the big changes would be particularly with your prescription drug plans.
Okay.
I mean, the federal government basically is doing the members a service by saying that your out-of-pocket cost for your prescription drug plans are not going to be any more than $2,000 over the course of the year.
Okay.
Of course, some people don't have a lot of medicine, so they'll never hit that $2,000 out-of-pocket. But there are a lot of people on 7 to 8 to 10 to 12 medicines, and they have a lot of expensive medicine. So
right.
That's one part of the drug plan change. And then they removed the donut hole. The donut hole is gone.
Can you explain what the donut hole is? I'm not there.
We'll try,
I'm not
but
there.
you guys can jump in. But
yeah.
So there are like 4 phases of a prescription drug plan.
Okay.
There's a premium, and a lot of plans that are standalone don't have premiums, or some of them do. Some of them in the Medicare Advantage plans that are embedded, they do or do not have premiums. And then you have the deductible. And the deductible for 2025 is going to be $590. So that's the first part of it. So if the deductible is met or parts of it are met, then the person then goes into the initial phase of their drug plan where they're paying a copay, and then the cost of the drug is factored in from the manufacturer. And so as those amounts aggregate, they would come to another dollar amount. So in this year, 2024, that would have been a little over $5,000, and a person, once they reached that area, would bounce into the donut hole.
Okay.
Okay, but in 2025, the donut hole's gone, so this year it's the deductible, the initial phase, and when they get to an out-of-pocket of $2,000, they bump into the last phase of the drug plan, which is called catastrophic coverage. And when they bounce into that, there's no cost. So that's the quick. Does that sound right to
And
you
I think
guys?
the main thing about the donut hole that I want to make sure people understand is that's when they pay more for most of their prescriptions. So that's the time of year that us as agents receive phone calls from our customers, from our clients. They say, I was paying this amount for my prescriptions, and now I'm paying double or triple what I was paying. And it's because they've entered that donut hole. So it makes it very difficult for someone to budget throughout the year for their cost of their prescriptions.
Right.
So that's what's gone away, as Paul said, in 2025. They won't have that anymore. They won't have that bump in their cost of prescriptions
Okay.
in 2025.
And so in addition, the member cannot, as we sit down and we're doing reviews with members now, because we're in the annual enrollment period from October the 15th through December the 7th, and in reviews, the member's saying, well, my drugs are not costing me anything right now. You cannot compare what's happening now with what is going to happen in 2025.
Okay.
And so the big takeaway from what I just said is, regardless of whether you have a standalone prescription drug plan or you have a drug plan that's embedded in a Medicare Advantage plan, you need to talk to somebody about your medicines, because it is potentially going to change in 2025. We're already seeing that. So,
Okay.
yeah.
Devoted Health, somewhat new on the scene, and we were talking before we started taping. It was started by two gentlemen.
Yep.
Can you tell me a little bit about that?
Brothers Todd and Ed Park started Devoted Health
Okay.
several years ago, and they had success in the healthcare space back kind of a few years ago in the 90s with Athena Health and how they were managing emergency medical records, or no, I said emergency, electronic medical records,
Okay.
Electronic health records, what they call today. As their parents were aging into Medicare, they realized there were quite a few gaps and quite a few reasons of why they thought they could help and bring some of that experience that they had on the technology side into the Medicare space. And so that was the genesis, if you will, the impetus of starting Devoted.
Where
And
is
now,
Devoted located? Where do you service?
so we are currently in 2024 in 13 states, but we're launching into 7 new states for 2025,
Okay.
which includes Arkansas and Missouri.
Okay.
So very excited about that.
Absolutely.
It's been growing, fastest growing, for several years. So
Yes.
yeah. It's just nice to see the hard work that's happened over the course of time, and the mission to treat every older American like they're part of our family.
That would be nice.
Seeing that played out,
Yeah.
and that's what Todd and Ed wanted from the very beginning, and we're seeing that happen. And so it's exciting to bring that into Missouri and Arkansas as well.
Yeah, absolutely. Kimberly, how long have you been
In the Medicare
in
space?
the Medicare space?
So I've been an insurance broker for 6 years, but
Okay.
prior to that, I was an occupational therapist for 25 years. So I worked very closely with Medicare clients on the healthcare side. And then I also spent about 7 years doing independent medical reviews for Medicare and for other insurance companies. So looking at the fine print, being able to really help a person understand or be able to look at the payment and the benefits, and that's helped me now be able to help people understand their Medicare coverage.
So coming from an occupational therapy standpoint,
Mm-hmm.
how does that affect how you advise your
Yeah.
clients? Does it play
It
a
definitely
role?
plays a role because I understand a lot about their medical conditions, their prescriptions, what they have in store for them with their health conditions that they have. And as a therapist, my goal was to hear their problem and solve their problem. And that's what I do as a Medicare insurance broker is I listen to them, hear what it is that's important, and then I'm there to really help solve a problem, help them find the best plan for them, make sure their prescriptions are covered, their providers are covered,
Right.
their co-pays are low. So I take a lot of the training as an occupational therapist into my world as an insurance broker.
Absolutely. Paul, I feel like you've been doing this forever, but you haven't.
Oh, I haven't. No, I'm a registered nurse by background,
Yeah.
so I spent 40 years in the healthcare space there, and then I've been doing this for about 5 or 6 years. And so, like Kimberly, we kind of bring a little bit of a different perspective sometimes because we've been in the healthcare space and we've actually seen care delivered through Medicare, and so it helps us help our clients kind of
Right.
educate them. So it really is fun.
Right.
It really is a fun. It's the best job I've ever had, really, honestly. So it's a lot of fun.
So, Jotham, coming in, I am not 65 yet, but I am creeping to that point. If somebody out there is new to signing on to Medicare, what should they be looking for? Because it's overwhelming, I think.
Oh, it can be a very overwhelming subject matter topic, or even when you get into it, how you navigate through the program. It can be very overwhelming. I would imagine anybody who is, on that cusp of 65 is getting a lot of information in the mail.
Yes.
Probably inundated with
Yes.
flyers and postcards and letters and so forth. We jokingly say, make a collection, get a shoebox, get an Amazon box, start throwing that in there. And I always say, find a local trusted advisor, and I think that's
Yeah.
very important for them to be local. Why? Because they know the area that you are in, right? They know this area and that you're in. Get one that is trusted, that maybe comes with a recommendation, or
Right.
that through some of your circles, whether it be someone you already do business with, someone that you maybe go to church with, or someone that your neighbor has had a good experience with, and make sure that they advise,
Yeah.
so that they can really give you not just the carrier information, if you
Right.
will, like the different insurance companies or Medicare Advantage plans or Medicare supplement plans that are out there. They should be well versed in those, but they should also know about the Medicare program itself,
Yeah.
and be able to guide you through some of those decisions that you need to make that would impact your individual health.
Okay, yeah. I know the medication is a huge one. I know that's a one you should definitely check every time. I know with the policy that I have, I take full advantage of preventative and wellness care. Are there any changes coming down on that we know of?
I don't think there's any, is
I
it?
don't think there's changes from
With
the
preventative on the
preventive
Medicare
care.
side.
Yeah. Yeah, there's lots of different categories that are covered in terms of preventive care. So
Okay.
it's important for a person to know what their benefits are, whether they're on original Medicare or Medicare Advantage, and what would be covered for prevention. So
Yeah, I think it's always good to look at the Medicare and You handbook. So that's issued to the Medicare beneficiaries every year. So
Yes.
if you look at the 2025 Medicare and You handbook, it will actually list out with a little blue flag that says, hey, this is new for this year.
Right, okay.
The preventive coverage is listed out with a blue apple. So you can kind of gauge through, okay, this is what the Medicare program covers, this is how preventive and wellness is covered,
Yeah.
and what you can expect as you engage and start that healthcare journey, or continue that healthcare journey through Medicare program.
So other than medications, what is another big change that you feel is happening with the policies this year?
I would say a big change that I've noticed is a lot of carriers are changing their plans in detail. So like, for example, a prescription drug company might have 3 or 4 plans right now. They're reducing to only 1 plan for 2025. So
Okay.
anybody who is currently enrolled are going to be filtered into this 1 plan. We've also seen where Medicare Advantage companies are pulling out of certain counties in certain states.
Oh, okay.
And so it just makes it even more important to meet with an agent or a broker like Paul or myself, to where you can really sit down and look at your options. Because if your plan is going away, that opens up different windows that you might have as a Medicare beneficiary, where you can look at other options. And it's just really important to know what the different plans are out there that are available to you. So a lot of changes with what's being offered.
I know on Facebook, which is where I get all of my information.
It's good, good source.
Very good source, very accurate. A lot of people are posting about my provider is no longer going to be taking, or my hospital is no longer.
Yeah. Yeah, and so just to kind of tag on to what Kimberly was saying, again, for all of you out there, just please, you can't talk to your neighbor that's on a plan and go and listen to them going, hey, I'm on this XYZ plan, you need to get on that. Everything is kind of driven by your medicines, and your situation is really kind of unique. And so it's fine to take a look at that and see if everything fits and those types of things. And then Kimberly said that some of the components of Medicare Advantage plans are changing. They are. Your co-pays are changing for all of your service items there.
Right.
And they're kind of trending higher. The co-pays are going up because of what I said first about the federal government saying, hey, we're only going to make you pay $2,000 out of pocket for your prescription meds. So
Right.
when they did that, then they shifted the burden. They the burden
Yeah.
of cost shifted somewhere else, and it
Sure.
shifted back to the carrier or the insurance company. Wouldn't you agree? Guys?
Yes, I do agree.
Yeah, as you're saying, some of those factors for 2025, they have a fancy word called utilization increase, right? What does that mean? Well, people are using the doctor more. Maybe post-COVID, we see that. Post-pandemic, things that may have been put off for a year or two are now happening,
Yes.
right? So you have those costs. You have medical inflation. So the actual service may be more expensive this year than it was last year. The changes that are very positive to the member, as Paul's saying, it's all of those factors can play into how the actual company has to what they call file a bid or say, hey CMS, the Centers for Medicare and Medicaid Services, government, if you will, this is how we're going to administer this plan this year and what the benefits are going to be and what the cost is going to be. And all of that changes every year. And I think we are seeing some of those changes in 2025 that may be a little more than what we're used to. And so it's very important for every Medicare beneficiary to go and get an evaluation.
Oh,
say, hey,
absolutely.
like what is changing in my county? What is changing for me? Maybe my health has changed this year. What does that look like going into 2025? And then, so I just kind of go back to getting to that local trusted advisor like Paul and Kimberly, and then say, hey, can we review this? Like, what are the new options here? And of course, from my perspective, Devoted's a new option here in Arkansas. So it's like, yeah, absolutely.
Sure.
Look at, and I think you should look at all the options that are out there just to make sure you are in the plan that solidly meets your needs.
And I think we see with our seniors, unfortunately, a lot of telephone calls and people start changing their plans, not really knowing why they're changing it. And so always it's go see an advisor and go see an independent advisor, I think, also, so you get a wide range of products too. So with our seniors, do you feel like they're using telehealth, telemedicine a lot?
I haven't seen it too much
Okay.
with that population, no.
They like to go in person.
In person, yeah.
We've seen an
Have you
increase
seen
in
some?
it.
Okay.
Yeah.
But I don't know that it has overtaken the desire that they would still want to see face-to-face.
Right.
I think telehealth is absolutely beneficial in a lot of instances where someone may not be able to get out or may not be able to get out quickly, and they can use that tool, if you will, or that mechanism of interaction to really get service on a very quickly needed basis. So I think it definitely has its place.
Yeah, it can be a very useful tool because a lot of our folks don't drive anymore.
Yes.
Or it's very difficult for them to get out of their homes and they're living alone. So
Right.
it's a very useful tool and it's built into practically every plan.
So what is the point that people have to decide on their plans again? What's the open enrollment period?
Just through December 7.
December 7.
Mm-hmm.
So don't December 5th think, ooh.
Yes.
So,
Don't
and I'm
wait.
sure all of you are seeing folks and going through plans with them. So is the important thing to bring a list of your medications if they come see you? That's going to be a big thing?
Prescriptions, it's helpful to have the name of the prescription, the dosage of that prescription, and how
Okay.
often they take it.
Okay.
We also like to know which pharmacy or pharmacies that they go to so that we can search the plans with the pricing of prescriptions at those specific pharmacies.
Okay.
And then we also need a list of their medical providers and hospitals, because that's another really key factor, is making sure that not only are the prescriptions covered, but we want to make sure that their primary care doctor and any specialist that they see are covered as well.
Okay.
So all of those things are what we ask ahead of time.
Yes. And people get attached to their providers, so I'm sure
Right.
when somebody is not in their network anymore, that's a big change for people.
Definitely.
They get used to people, so.
So we try to really work with them on finding a plan that they don't have to change their provider. They would be able to keep their same providers, and then we work to find a plan that fits within those providers.
So Paul, with your background, do you ever go, why are you on this medication?
Well, I don't really do that. I mean, because it's been a while, it's been a hot minute since I've been in that world,
Right.
But no, I always, you might want to talk to your physician about this,
Right.
But we will say that it looks like this particular medicine's not going to be covered in 2025 and the alternative's not going to be covered. Let's send a note to your physician and let them know that.
Right.
So if they want to ask for an exception to the formulary, we can get that going. We'll have a heads up on that and you don't get caught on the backside of that, trying to scramble to get the medicine.
Okay.
The only other thing, we've talked about Medicare Advantage, just one tip to you folks who are on Medicare supplements or Medigap plans, this is, you don't really need to do anything with your plan during the October 15th to December 7th period unless you feel like that you're healthy enough to maybe make a change to something that might allow you to go to a different company. You have to go through underwriting most of the time.
Okay.
But normally you're just kind of, all the advertisement you see on TV is really related to Medicare Advantage. So you guys just keep paying your premiums and just keeps rocking on. You don't have to really do a review for that. But your prescription drug plans, that's where you need somebody to help you with those, because those are just like the prescription drug plans in the Medicare Advantage plans. They're gonna be impacted in 25. Okay. So.
Time has run out. I'm so sorry. I think we could go on for another segment there. Thank you so much for being here. This is going to be on the Roku channel, and it's also going to be on YouTube. So if you see it on YouTube, please do make comments. We'll get our panelists to weigh in there with some information if you're asking questions. So so Senior Happenings, find that on YouTube, and we can start a dialogue and ask more questions. Thank you so much for being here. I really appreciate it. Thank you.